I'm Dr. Sabrina Siegel with the Neuroscience Education Institute, and twice a month I sit down with a renowned mental health care expert to discuss breakthroughs and best practices for treating patients with mental illness. In this episode of the NEI podcast, I have the pleasure of interviewing NEI's Chief Medical Officer, Dr. Andrew Cutler, as we take a look back in the year of 2019 and we reflect on the most exciting news in psychopharmacology. Welcome, Dr. Cutler.
Well, thank you very much. It's a pleasure to be here.
Dr. Cutler, what are some of the new medications approved by the FDA this year for different psychiatric conditions?
Well, I have to say, it's been a banner year this year. There have been a number of new medications approved for psychiatric and neurologic conditions that might be important for people in the mental health space to know about. One that I want to start with was for a whole new indication, which we've never had a medicine approved for before, and that indication is postpartum depression. And the FDA this year approved intravenous brexanolone, which the brand name is Zulresso, and this was approved for use for postpartum depression, which affects as many as 20% of women following delivery. So this is a very common condition that's very serious, that doesn't, even though it's a form of major depressive disorder, it doesn't respond as well to traditional antidepressant medications. So this is a major step forward and a major development. And I would say also paves the way for potentially other effective medications being studied and approved to treat postpartum depression. Now, sticking in the depression space, another really important approval this year was intranasal S-ketamine spray for treatment-resistant depression, and the brand name of this medicine is Spravato. You know, ketamine, for many years we've known ketamine is a rapid-acting antidepressant, but it has to be delivered intravenously. And ketamine is a racemic mixture of two different forms of ketamine, R and S-ketamine. And so S-ketamine is one of the two enantiomers of ketamine. And here we have a way to deliver it rather than intravenously, a convenient nasal spray. Now, this has to be delivered in a provider's office, in a healthcare provider's office, and patients do need to be monitored for a couple of hours afterwards because of some of the risks, including dissociation and somnolence and blood pressure increases. But I would say that this is quite an exciting development. It opens the door now to finally an FDA-approved rapidly acting antidepressant. When I say rapidly acting, I'm talking within a matter of hours to days rather than weeks. Ketamine, as we know, again, is approved, is effective, but is not FDA approved. And it's very important to have drugs FDA approved for two main reasons. One is because there's a good chance that you can get the medication paid for, which is obviously important to get it into patients' hands, but also because you can do promotional education around the medicine if it is FDA approved. So this is a very big deal. Also, there were two medications FDA approved for excessive daytime sleepiness with narcolepsy. This is referred to as EDS, excessive daytime sleepiness. The first one is pitolisant, which the brand name is Wakix, W-A-K-I-X. And this one works through histamine receptors. It's an H3 antagonist. What that does is that increases the release of histamine, and we know that histamine is a wakeful-promoting chemical in the brain. Just think about antihistamine medications, such as diphenhydramine, and how they can cause sedation. And this is the opposite. Instead of antihistamine, we're increasing the amount of histamine. The other medication that was approved is called Sunosi, S-U-N-O-S-I, and the generic name is solriamfetol. And this is a medication that is a norepinephrine and dopamine reuptake inhibitor, and this also improves wakefulness associated with narcolepsy. These medications are both also being looked at for other potential indications that may have to do with sleepiness. Now, the ADHD space has also seen quite a bit of activity this year, and two medications I want to mention. The first one was actually FDA approved in February of 2019, and that's Adhansia XR, Adhansia, Adhansia XR. This is a novel delivery system of an extended release version of methylphenidate, and the delivery here is prolonged over a period of 16 hours, and they've demonstrated efficacy up to 16 hours. So this would be a product that would be especially useful for maybe adolescents or adults, not necessarily younger children. Another new form of a stimulant approved for ADHD is called Jornay PM, Jornay. Now, Jornay PM was actually FDA approved in August of last year, 2018, but it wasn't launched. It didn't become available in the market until June of this year. So I refer to it as something that became available this year and that clinicians should know about. Now, this is very novel because this is an extended release version of methylphenidate, but you take it at bedtime. And what happens is they have a novel proprietary release system. They call it a delayed and extended release system, and the trade name is Delexis for the delivery system. And you take it at bedtime, and it delays the release of methylphenidate into the bloodstream for 8 to 10 hours. So it starts kicking in the morning when the patient first wakes up. And this is meant to address the problem that ADHD begins as soon as the person wakes up. But if you take a traditional stimulant in the morning, there's a lag of anywhere from 1 to 2 hours before the medication becomes effective. And people with ADHD can have significant early morning impairment, functional impairment. Now, moving along to another indication, which is important for psychiatrists to know about, that's migraine headaches. And there was a new medication FDA approved this year called Rayvow, Reyvow. The generic name is lasmiditan, Lasmiditan. Now, this works through an extremely novel mechanism as well. This works through serotonin 1F receptors, F like Frank. And we know that these receptors are probably located on blood vessels and can have to do with the constriction of blood vessels in the brain. So this is a medicine that has been shown to be effective and is really a totally novel mechanism. We have, of course, for years, we've had triptans on the market that work through serotonin 1B and 1D receptors. And in the past couple of years, we've now had another new generation called CGRP antagonists, calcitonin gene-related peptide antagonists. And those have been a major step forward. And now we have this other new mechanism that for migraine. And so the promise here is that some people don't respond to one type of medication and might need a different mechanism of action. So I would say that this is also a very exciting development in the field of migraine headaches. Finally, I want to mention FDA approved a new generic version of naloxone for opioid overdose. And this is, of course, hugely important from a public health point of view because we know that for the first time in many, many years in America, the life expectancy has actually declined for the first time this year in many, many years. Most of this decline is due to suicides and drug overdoses. And of course, opioids are the large cause of that. So the FDA and the government in general is trying very hard to do everything they can to combat the opioid crisis. And one of the things is to make naloxone more widely available to reverse opioid overdoses. Naloxone, of course, is a mu-opioid receptor antagonist. And this particular version of the generic naloxone that was approved as an intranasal version, which would be very important, very helpful for situations when it's hard to get an IV placed. There is one other medicine I do want to mention, and that is the first transdermal antipsychotic, which is a patch version of acenapine, and it's called Secuado, Secuado. This is very important. Acenapine has been on the market for many years in a sublingual version. And this is, again, a transdermal patch. Acenapine, if you take it orally, is not very bioavailable. It's not well absorbed at all. So you have to find other ways to get it into the system. And so the Staccato is a very big development from that point of view. What's nice about a patch, of course, too, is you know that the patient's being compliant with a patch. You can see that it's on the person, and if they take it off, you would know about it. So the problem with the sublingual version of acenapine is there is a funny taste and a sort of a numbing that people can get that some people find uncomfortable. So this gets around that. And that also is a very exciting development. So we've had, as I've mentioned, a number of new medications FDA approved to treat a wide range of psychiatric and neurologic conditions. And there are certainly lots of other exciting medications in development. So we really are entering a new phase, a new era of psychopharmacology.
Yeah, absolutely. Thank you so much for sharing all of that with us. What are some of the novel medical devices that were approved by the FDA this year?
Well, there are two that are important to mention. The first is called Cervella, Cervella, for depression. And this is delivered via a headset, sort of a transcranial neurologic stimulation. Cranial electrotherapy stimulator device is what it's known as, or CES. And this delivers low-level micropulses of electrical current across the skull into the brain via electrodes that are integrated into ear cushions of stereo headphones. It's also managed through an app that would be on your phone. So this is really a whole new era. I wrote an article actually last year called Beyond the Pill, where I started talking about some new ideas of treatments going beyond our traditional pills. And one area that's really exciting is this area of devices. And another area is digital interventions, which I'm actually going to mention in just a minute. But devices to treat psychiatric conditions is a whole new era of thinking about it, a whole new way of thinking about treating these disorders. Now, another device that was approved this year was approved for ADHD, and it's called the Monarch ETNS device. And this device is a trigeminal nerve stimulating device. And the way this is used is it's a small patch that is put on a child's forehead, and it stays there overnight while they sleep. And this patch is connected to a device that is delivering, again, low-level electrical pulses. And there was a study that was done that was positive. It showed that this medication, it decreased symptoms of ADHD measured by a rating scale, and it was found to be extremely safe. And again, it's lower levels of electric stimulation that are being delivered. So these are two devices. I mentioned something else, which is digital interventions or digital therapies. There's a company called Achille Interactive, which has developed a digital therapeutic video game, if you will, called EVO, that has been studied and was shown to be successful to treat ADHD, and it's also being looked at for autism and some other conditions. And then the other area that is getting a lot of attention is the use of apps to help track things. And I mentioned that some of these devices have apps associated with them as well that help either control them or track the effects of the device. So I think this is a whole new era. We're just starting to see a bunch of these things being developed and now starting to finally reach the marketplace, which is very exciting. And, there are a lot of patients or family members who prefer not to use a medication. And so it's very important to have these options either to use instead of a medication or in addition, much like we use psychotherapy in combination with medications to treat various conditions. Maybe we can use these devices or digital therapeutic interventions along with medication to get even better outcomes.
Mm-hmm. Absolutely. What are some updates to current drug labels that the FDA made this past year, and what are the implications for psychiatric treatment?
Well, I'm glad you brought this up because every year we do see updates to the labels that the FDA asks for or imposes upon drug makers. And very often they do have significant implications. Sometimes we get a new indication, so a medication gets a newly approved use. And something that happened this year that I think is really important is cariprazine got FDA. This is known as Vraylar, and this had been approved previously for either schizophrenia or for manic or mixed episodes associated with bipolar disorder. But earlier this year, it was approved for bipolar depression. So now cariprazine is FDA approved for the full spectrum of bipolar symptoms, whether we're talking about depression or mania, or in between, where you can actually have mixed states, various combinations of depressive and manic or hypomanic symptoms. So this is a very exciting development. We certainly needed more treatments for bipolar depression in particular, because before this approval, we only had 3 medications FDA approved. And we know that not everybody responds to or tolerates certain medications. So it's really important to have more options. And bipolar depression in particular is very difficult to treat, does not respond well to traditional antidepressant medications. The FDA also prevented phenylephrine from being labeled for patients age 16 and younger. Pfizer, who's the manufacturer, this is Chantix. Pfizer did a study looking at patients 16 and younger for smoking cessation with Chantix, and unfortunately the study was not successful. So this is something that is put into the label now, that there was a study that was not effective. So it's not approved for that use. Also, the FDA added a boxed warning to various insomnia medications, the so-called Z drugs. And this is a warning that has to do with various bad outcomes having to do with sleep-related behaviors. So this includes things like sleepwalking, sleep driving, or other activities while not fully awake. And sadly, these resulted in some cases in injury or even death. And so as far as the specific medications that I call the Z drugs, that's Zalpalon and Zolpidem and S-Zopiclone. So S-Zopiclone is Lunesta, Zalpalon is Sonata, and Zolpidem is Ambien, Ambien CR, Edluar, Intermezzo, and Zolpamist. So the FDA identified 66 cases of complex sleep behaviors occurring with these medicines over the past 26 years that again resulted in serious injuries, including death. So I think that those are some of the very important label updates from the past year that we've seen.
Wow. What are some of the most influential clinical findings that were reported this year on mood disorders?
Well, first of all, I mentioned earlier about the approval of a version of ketamine called S-ketamine, intranasal S-ketamine for depression. There's another medication that's being studied that works a little differently, but has also been shown to be potentially a fast-acting antidepressant, and that's called Sage-217. And Sage-217, instead of working through NMDA glutamate receptors, which is how ketamine works, this works as a positive allosteric modulator on the GABA-A subunit or GABA-A receptors. And so this is really interesting because glutamate and GABA represent potential yin and yang in the brain, where glutamate is sort of the gas pedal. It's the major stimulatory neurotransmitter in the brain. And GABA is kind of the brake. It's the major inhibitory neurotransmitter in the brain. And so it's fascinating that we have drugs that act on both the gas pedal and the brake, if you will, that are effective for depression. So there was a positive study, phase 2 study reported for Sage-217 that showed efficacy within a couple of days. And Sage-217 is a pill. Now, I mentioned earlier also the medication that was approved for postpartum depression, and that was intravenous brexanolone, known as Zulresso. Well, this is a pill version that works in a similar mechanism. It's not exactly the same medication, developed by the same company called Sage. Now, sadly, just literally a couple of weeks ago, a large phase 3 study with Sage-217 for major depression was reported to be a failed study. So we certainly hope that more studies will be done. It's not unusual to have a failed study, especially for depression. We know that approximately 50% of our studies for MDD do fail. And it's not always because the drug doesn't work. It's because sometimes you have a high placebo response, or there's some other issue that might have to do with the the proper dose hasn't been selected, or some other methodologic issue in the study. So Sage 17, in addition to the phase 2 study for depression that was positive that I mentioned, also had a study for postpartum depression, which is what Zulresso is approved for. But again, Zulresso is an intravenous and Sage 217 is a pill. So there are 2 depression studies, one for major depressive disorder and the other for postpartum depression, that were positive. And then this new study that was unfortunately negative for MDD. So on the whole, we have 2 positive and 1 failed. And hopefully there'll be more studies. There are some other studies ongoing, and hopefully we'll learn more about that. But we're very excited about the potential for this new mechanism of action, rapidly acting antidepressant. There was also a study of sertraline plus olanzapine for psychotic depression that was positive. We already have an SSRI plus olanzapine FDA approved, of course. That is fluoxetine plus olanzapine. And that's approved for psychotic depression already. So this was a sertraline plus olanzapine. Also, there was some positive suicide findings as well. Also, I want to mention a non-stimulant medication in development for ADHD, which I think is very exciting. And that is a drug called SPN 812. The generic name is viloxazine ER. So it's an extended release version of viloxazine. Now, viloxazine is a drug that was approved and marketed for many years for depression in Europe, never approved in the United States. And it works through a somewhat mysterious mechanism of action. We know that it's a norepinephrine reuptake inhibitor, but it has modest effects on that. It also binds to certain specific serotonin receptors. And what has been shown in animal models is that this drug increases levels of serotonin, norepinephrine, and dopamine, especially in the prefrontal cortex. So this is a medication that has a unique and novel mechanism of action. And this year, a very large phase 3 program in children and adolescents that was positive has been reported, where viloxazine ER improved symptoms of ADHD in children ages 6 to 11 and adolescents ages 12 to 17. And it's very exciting that just a month ago, in November of this year, the company that makes the drug Supernus filed with the FDA for approval. So potentially next year, we'll have another new non-stimulant medication to treat ADHD. This is a huge unmet medical need, because right now we only have 3 non-stimulants FDA approved, and that's Strattera and Intuniv and Capvey. Unfortunately, only Strattera is approved for adults. So we only have 1 non-stimulant FDA approved for adults, and then all 3 of them are approved for children and adolescents. But they have various risks and limitations, so it's certainly good to have more options. Now, there's been some other exciting research reported out this year in the area of psychosis, and one in particular that I want to mention is something that I like to think of as almost the holy grail of schizophrenia treatment, and that is a new medication that does not work directly on dopamine D2 receptors. Currently, every antipsychotic medication that's approved is an antagonist or a partial agonist, but functionally working as an antagonist on D2 receptors. And the problem here is that can cause a variety of side effects and risks, including neurologic effects like EPS and tardive dyskinesia. Also can cause endocrine problems, and that's elevation of prolactin, and also have been associated with various cardiometabolic risks. So there is a medication being developed by Synovian that is referred to as SEP856. This drug works through TAR1 receptors. It's a TAR1 agonist, and TAR is TAAR, stands for trace amino acid receptor. And this is a TAR1 agonist. And this year, Synovian reported out in a couple of different medical conferences positive phase 2 data treating patients with schizophrenia with acute psychotic exacerbations. The drug was shown to be effective and extremely safe and well tolerated without any of the traditional side effects associated with antipsychotics, no weight or metabolic signals, no effects on prolactin, and no neurologic side effects. So certainly this needs to be replicated, and Synovian is gearing up for a larger phase 3 studies that would be registration or pivotal trials to try to get it FDA approved. Data was also reported out this year on a very exciting new medication that is called ALKS 3831. Now, this one is a combination of olanzapine plus samidorphan. Olanzapine, of course, we've known for many, many years as Zyprexa. Samidorphan is a mu-opioid receptor antagonist that's highly potent, and we combine the two together into one pill, and the thinking is here that this will decrease the weight gain and some of the metabolic issues seen that limit the use of Zyprexa. We've known for many years Zyprexa is an extremely effective antipsychotic and bipolar medication, and we would like to use more of it, especially for long-term management of these patients. But that's been limited by the weight gain and metabolic problems. So data has been reported out that this combination of olanzapine and samidorphan was superior to olanzapine alone as far as weight gain. It caused less weight gain. And theoretically, then, we can extrapolate maybe that it would also have a more favorable metabolic profile. Now, another new and exciting medication that has a somewhat novel mechanism of action and reported out some data this year is a medicine called lumateperone. Lumateperone is being developed by a company called Intracellular Therapies, and lumateperone works on the dopamine system, but not only on the dopamine system, and it works in a novel way. So the way that it works is it is a postsynaptic D2 receptor antagonist, but presynaptically it functions as a partial agonist. And what happens is the partial agonism presynaptically decreases the amount of dopamine being released, and at the same time, postsynaptically, we're blocking dopamine. So because we're decreasing the amount of dopamine being released, we don't have to block as many of the dopamine receptors postsynaptically, and this seems to decrease the risk of neurologic side effects such as EPS and hopefully tardive dyskinesia. Also, it doesn't elevate prolactin. Now, the medicine also has very potent antagonism of 5-HT2A or serotonin 2A receptors, and it also works as an agonist on D1 receptors, dopamine 1, which seems to increase intracellular glutamate signaling through the NMDA pathway. So this medication is working on psychosis via dopamine, serotonin, and glutamate, and so far has shown, as I mentioned, positive effects on treating psychosis and schizophrenia. The drug is also being studied for bipolar depression, and earlier this year, it was announced that there was a positive study with lumateperone for bipolar depression. Also, it's being studied as adjunctive therapy for unipolar major depression. The side effect profile has been quite favorable, and again, no neurologic side effects, no EPS or tardive dyskinesia has been seen, no prolactin elevation, and no weight gain or cardiometabolic risk has been seen. So it's very exciting that we might have brand new medications with really novel mechanisms of action available to treat schizophrenia, psychosis, and mood disorders.
Wow, that is excellent news. And thank you for sharing all those exciting updates.
There's one other one. I'm sorry to interrupt. There is one other one I do want to mention. A very interesting study was reported out at the American Psychiatric Association annual meeting earlier this year. There was a study looking at two different long-acting injectable antipsychotics. And, until some these newer mechanism antipsychotics are approved, we really want to try to make the maximum use out of the current antipsychotics we have. And one way to really maximize the effectiveness is through using long-acting injectable preparations, and there are a number of them available. Well, a study was done that was sponsored by Alkermes called the Alpine study. The Alpine study looked at using Alkermes' long-acting injectable medication called Aristata. And Aristata is a long-acting injectable version of aripiprazole. And they compared it to Invega Sustenna, which is paliperidone long-acting injectable. And what they found was that both medications were significantly effective at treating psychotic symptoms. These were patients with schizophrenia with acute psychotic exacerbation. And both were found to be extremely effective and very similar in their efficacy. And both were very well tolerated, although an interesting finding was that there were slightly more side effects with Invega Sustenna than with the long-acting injectable version of aripiprazole. And in particular, there was a slightly higher rate of akathisia noticed with paliperidone. There was also more weight gain, and there was a greater increase in waist circumference with the paliperidone versus the long-acting injectable aripiprazole. So I think this is very important to help inform clinicians that you can use either one of these versions of long-acting injectable medications, because again, some patients will do better with one than another or tolerate one better than the other. So I wanted to mention that study too, even though it's not novel mechanism of action drugs, because it is a way to maximize the effectiveness of drugs that we currently have.
This episode has been brought to you by NEI Synapse. Register now to take advantage of early bird rates. They'll only last through January 15th, 2020. So grab your seat now. Go to www.neiglobal.com. We'll see you there.